Hello everyone, welcome to Simple Chats. My name is Luisa and today we'll be chatting about vitamins. Eating a healthy and balanced diet during your pregnancy is going to help you to get all the vitamins and minerals you need. Well, at least that's what I thought until about a year ago. So before I thought that as long as I cook home, as long as I have broccoli in my diet, as long as I don't eat any fast food, that I'm all set. But about 2 years ago, I started having a skin rash and insomnia, and I went to see a bunch of doctors. And unfortunately, I was not able to get any help. I was not diagnosed, and obviously, when there's no diagnosis, there's no treatment. So that's when I realized that the only person who can help me is me, and I started just reading everything that had to do with my symptoms, and I even covered the subjects that barely had anything to do with what I was having. And now, knowing what I know, I am pretty sure that we cannot get all the vitamins and minerals our body needs from our food. One of the main reasons for that is soil depletion. Now, if you think about the amount of food that is being produced now is just absolutely staggering, like crop after crop. The soil even doesn't get the chance to restore its nutrient profile, and herbicides and pesticides that are sprayed on crops, it just makes the whole thing even worse. And because of the low amount of nutrients in our food, it's just really hard to get all the vitamins that we need. And even if we construct our diet in a way where we eat nutrient dense foods, like dark leafy greens, cruciferous vegetables, and healthy protein, even then there are types of vitamins that are really hard to get from food, like vitamin B12, omega-3 fatty acids, vitamin D3, and we need to eat lots of like leafy greens to get like vitamins like magnesium and potassium. So even if we try to have this healthy and balanced diet, even then it's really hard to make sure that we have enough to stay healthy, especially during pregnancy and in the lactation period. And again, as we age, our body starts absorbing vitamins less and less. So I wish that I knew this before, because in both of my pregnancies, I didn't take any vitamins. Well, with the exception of one a vitamin in my first pregnancy, which was folic acid, and in my second pregnancy I took iron, and that's it. Like I didn't believe in vitamins. I didn't think it was necessary, and now I wish that I was more educated and informed. So just a little disclaimer before we move on. I'm not a doctor. I don't have any license in medicine or nutrition, so please consult with your doctor before you do anything. Just talk to your doctor before you decide to take any vitamins or any supplements for that matter. So now that's out of the way. In my opinion, 3 vitamins that are important in pregnancy are vitamin B12, as I mentioned, vitamin D3, and omega-3 fatty acids. That's because it's really hard to get them from our food. Especially if, for example, vitamin D3, if you live in a country where you don't really get that much sunlight, because vitamin D3 we can absorb it, synthesize it through our skin. So if you don't get that much sunlight, pretty much it is a reason for taking vitamin D3 supplements. And a lot of people have deficiencies in vitamin D3 because we spend more time indoors than outdoors these days. So I would advise you to check your vitamin D3 levels. So you need to take a blood test that's called vitamin D3 25OH. This is the blood test that shows you your vitamin D3 levels, and then from there on you can consult with your doctor and then see what dosage you should take. I had to take iron in my second pregnancy because I was feeling really very sleepy and very unwell. I wasn't feeling good, and I talked to my doctor, and she said, okay, so your iron levels are quite low, but they are in the normal range, which is sort of okay. And in the beginning, she didn't really want to prescribe me iron. She said, oh, it just looks fine. But then when I checked, I was like, okay, but this is like at the edge. My iron levels were like very low, but they were barely making it to the normal range. And so I was able to convince her to prescribe me iron. And honestly, I was not able to take it orally. Like, I was not able to, it just made my nausea so much worse. It was really bad. So I stopped taking it orally, and then she prescribed me iron, like injections. Like, I would get iron injected into my veins once a week. So the first time when I got it, it was, oh my God, it was a life changer. I felt so good. Like, I was just full of energy. My brain was like, I was just thinking so much clearer now. It was really good. And by the end of the week, I started feeling again a bit sleepy and again unwell. So I was very much looking forward for my second injection, and something went wrong here. Right after the injection, I was not able to breathe well. Like, I was just like really having a hard time to breathe, which is like really scary. And I couldn't hear well, and I couldn't really see well. Everything went blurry, and the nurse got really scared, and then she called the doctor, and everyone got scared. So the whole thing, just understanding that everyone else is a little bit like scared, just made it even worse. After about 10 minutes, I started feeling okay again, and then I was told, okay, so I had reaction to iron, and it's just not to worry. It's fine. And I was very surprised at this point, because I thought that there's no way that they will do that again, that they will give me iron again. But they were like, no, you can come back next week. Everything is fine. So on one hand, I was like, okay, I was very much looking forward to it again, because I really needed it. But then on the other hand, I was really scared, because it was a really scary experience. So I went there the third time, and it happened again. Again, I couldn't breathe. It was just like very scary. And this time I could hear the doctor just, saying, oh, so dumm, so dumm. And I'm in Germany, everyone speaks German, so dumm means like, we're so like, this is stupid, why did we do this again? I was again scared, but I don't know, but this time everyone just like, okay, so, we're not going to do this again. But then I realized that later that iron should be infused. Like, you should not get iron injection, but it should be dripped into your veins, like with infusion, because it's just getting like a big dose of iron immediately like into your bloodstream is gonna obviously give you a reaction, or it has to be like injected like very slowly and gradually. So yeah, I actually wouldn't advise you to get, if you have anemia, if you're having iron deficiency, and if you are prescribed iron, and if you cannot take it orally, most of the time pregnant women cannot take it orally because of the nausea. But if you cannot take it orally, I would advise you to get the infusion and not injection, because I don't think it's worth it. But even if you, for some reason, cannot get infusion and you have to get injection, then I would advise you to, I don't know, lie down. Like, I wish I was like because they injected when I was like in the seated position, and when that reaction happened, I really badly wanted to lie down because it was very scary. I couldn't breathe, and I felt like I can breathe better if I was in a lay down position. But they laid me down later when I started having a reaction, but I wish I was in this lying position and not in a seated position when I was injected. And what I also realized is, when you're injected iron into your bloodstream, it's important that it's kind of not hot in the room, that you're not sitting right next to the radiator. I think that's what made it worse, because iron is just like you immediately feel warmth in your head, because it's just like it's just now in your bloodstream. It's just like iron is in your body, and it just kind of increases your temperature a little bit. So it's better you take off your sweater, that you're not like you don't have like a warm clothes on you, and the room is not very hot. So if you're being injected iron, make sure that it's kind of low temperature in the room, you're in a lying position, and that you don't have too much clothes on you. So that would be my advice. And another vitamin that is recommended is folic acid. Folic acid is something that helps the neural tube formation of your baby. So it is recommended to take it 3 months in advance, like 3 months before you're pregnant, and then 3 months into your pregnancy. And I would advise you to take folic acid. Like folic acid is synthetic version, like folate is the natural version, the natural form of it. So if you can find folate, I would advise you to take folate instead of folic acid. But if you're late already in your pregnancy, it's 4th or 5th or 6th months of your pregnancy, then don't worry, it's a preventive cause, and it's a preventive measure, so it doesn't. I myself have forgotten to take it in my second pregnancy, and my baby was born fine. But again, talk to your doctor. Maybe you can take it at later stages of a pregnancy as well, but I'm not sure about that. And another vitamin that I think is very important is iodine. But for example, in my home country, in Uzbekistan, a lot of people have iodine deficiency because iodine is not in the air, is not in the water, and it's just Uzbekistan is a sort of like double landlocked country, and iodine is just not in the air. But in Germany, where I am now, Germany is very close to the sea and the ocean, so there is iodine just naturally in the air, in the water, and so I don't really have to supplement iodine. But like if you're in a country now where iodine doesn't naturally occur, I think that it would be, actually it's like very important to take it during a pregnancy if you live in a place where a lot of people have iodine deficiency. So yeah, that is it for today. I hope that was helpful, and I would really like to know what vitamins, if you're pregnant now, what vitamins are you taking, and what vitamins were you recommended to take. I'll put some links in the description box for you to articles and studies that talk about the nutrient profile of our food, soil depletion, and so on. I hope that you found this video useful, and I'll see you in my next video. Bye.